Oh, hello guys, welcome back to my YouTube channel. I am Divya, CPC certified medical coder. So today I'm going to explain about the respiratory system. So in the respiratory systems comes under the 30,000 series. And in the 30,000 series, they were divided into two parts. That is the respiratory system and the cardiovascular system. But we will discuss about the respiratory system here. So it comes under 30,000, you can see. So this is respiratory system image, you can see. Now, without any further delay, let's get started. So in the respiratory system, topics. So the topics we will discuss is the nose, in which we will discuss that these were the procedures present: septoplasty, rhinoplasty, turbinectomy, nasal endoscopy, polypectomy, nasal fracture repair, foreign body removal. Okay. The second part is accessory sinuses. In the accessory sinuses like sinusotomy procedure, maxillary antrostomy, ethmoidectomy, sphenoidotomy, and frontal sinusotomy, sinus endoscopy, functional endoscopic sinus surgery. So, coming to next, that is larynx. So, in the larynx, we will discuss about the larynx procedure, laryngoscopy, microlaryngoscopy, vocal cord biopsy, lesion, injection, laryngectomy, tracheostomy. Coming to next, that is trachea and the bronchi. In the trachea and the bronchi, we will discuss about the bowel procedure, bronchoscopy, transbronchial biopsy, EBUS, foreign body removal, trachea resection repair, brachioplasty. Coming to next, that is lungs and pleura. In the lungs and pleura, we'll discuss about the VATS procedure, lung biopsy, thoracentesis, wedge resection, lobectomy, bulectomy. So these were the procedure we will discuss in the lungs and the pleura. So before going to procedure, before knowing the coding criterias, before knowing the ICD and CPT, the most important thing is we have to understand the basic anatomy of the respiratory system. So, guys, what do you mean by respiratory system? It's an organ system. Which organ system? Which is responsible for the taking the oxygen into the body and removing the carbon dioxide from the body. And its main function is just breathing, gases exchange, voice production, sense of smell, filtering, warming, and humidifying, etc. Coming to next, that is for the convenience, the respiratory system is divided into five parts. The five parts are upper respiratory tract, lower respiratory, lungs, pleura, and other important structures. So guys, we'll see one by one with the help of the diagram. So you can see here, this is an upper respiratory tract. This one is upper respiratory tract area. This one is lower respiratory tract area. This one is lungs. This one is pleura, which is an outer covering you can see, and this alveoli in a uh, here. So in the upper respiratory tract, that is an which constitutes the nose, nasal cavity here, which helps the filters and moisten the air. The second one, which is paranasal, just here, paranasal sinuses, which is nothing, just an air-filled spaces in the skull. The third one, that is pharynx. The pharynx is also known as throat, the pathway for the air from nose, mouth, and larynx. The fourth one is pharynx. So fourth one is the voice box, that is larynx, for the voice production. The fifth one, the epiglottis, okay, which prevents the food from entering the airway. Okay, now the lower respiratory tract, which is first, that is an trachea, which is also known as windpipe. This one is trachea. It is an just tube-like structure that carries the air to the bronchi. So this trachea divides here into two parts, which enters into each lungs. This is trachea, which enters into two lungs. That is, this is bronchi, two main branches divided and enters to each lungs. After that, this bronchi, uh, there is bronchioles. You can see these are the bronchioles. These are the smaller branches of the bronchi within the lungs. Okay, after that, this is alveoli. In the end, there is alveoli, which is also known as air sac, and this which help in gaseous exchange. Gaseous exchange is nothing, just to bring oxygen into the body and remove the carbon dioxide from the body. Okay. After that, this is lungs. You can see. So the human body have two lungs, right lungs and left lungs. So in the right lungs, there is three lobes. Okay. The superior, middle, and inferior. And the left lung, there is two lobes, superior and inferior. And here is a muscle structure you can see, that is a diaphragm, and there is a pleura. So what is this pleura? The lungs are surrounded by a double layered membrane which is known as pleura. The double layer membrane which is known as pleura. So these two layers are parietal pleura and the visceral pleura. And in between them, there is the pleural cavity. So the visceral pleura, what we can say, directly covers the lung surfaces. Okay. And the parietal pleura, what it lines the inner thoracic wall. Okay. And in the pleural cavity, it is in just in space which contains a small amount of what fluid that allows the lungs to move smoothly during the breathing. So just learn that the visceral on the lungs, okay, and the parietal on the wall, okay. And this is an big structure of alveoli, okay. There is in capillary networks. You can see oxygen enters to the blood and carbon dioxide leaves the blood, okay. So simple pathway, you can just learn that the air pathway, how the air enters. So the air enters into the nose, after that it goes to the pharynx, okay, pharynx, then larynx. After larynx, then it goes to trachea, bronchi, bronchioles, and the alveoli. So this is a simple pathway and simple uh, structures, okay. So now come to next, okay. So what were the important structures of the respiratory system? So these were the four structures which is important structure, that is an diaphragm, mediastinum, heart, and ribs and thoracic cage. So guys, this one is diaphragm. You can see this one is diaphragm, and diaphragm, how it's look like, it is dome shaped muscle, okay, which is just located just below to the lungs, okay. And the fun fact is that is important fact, that when we inhale, breathe in, then this diaphragm moves down, okay. I will see you by the help of um, like this, okay. When we inhale, then it will contracts and move down, okay. And when we exhale, then what happen, then it moves up like this, okay. So coming to next structure, that is the mediastinum. So mediastinum is a central compartment in the thoracic cavity, and this one you can see this is an thoracic case, okay. And in the inside there is an cavity, okay. So in that cavity, what happens there, in this central cavity between the two lungs, there is a space, okay. And this space, what contain? This space contains the trachea, heart, esophagus, thymus, and vessels and some lymph nodes. Okay, and heart is here, just in the left side of the lung. And the what is ribs and thoracic case? These cases were the protective covering of the lungs. Okay, coming to next, that is now we'll see all the structures, all the parts in detailed way. So the first one is the nose and the nasal cavity. So nose is just an entrance of the respiratory tract, and its main function of the nose is what, filtering the air, warming the air, and humidifying the air. So this is an external nose, you can see here. This one is a part of the external root, dorsum, and ala, we can see here. And there is a nostrils. Nasal opening is known as nostrils. Okay. And coming to the front view of the nose, when we see in the front view, then this nasal cavity, there is nasal cavity. In the nostrils, there is nasal cavity, okay? And these cavities divided into the right nasal cavity and the left nasal cavity by the help of nasal septum. This one is nasal septum. You can see this one is nasal septum, and this nasal septum divides the nasal cavity into two parts, that is right nasal cavity and the left nasal cavity. Okay, and uh, after that there is an structure which is known as turbinates. Okay, turbinate is what? Turbinate is just a curved bony structure inside the nose, which is covered by just a rich layer of the soft tissue and the blood vessels. So these turbinates are just bony curved structures which helps in what? Which like warms and humidify and filters the inhaled air before it reaches to the lungs. And these were the three parts: the superior, middle, and the inferior turbinates. Okay, and they also increase the surface area inside the nasal cavity. Okay, so the key points: there is nasal cavity, spaces inside the nose through which the airs enter. Okay, nasal septum is just a wall or a cartilage and bone that divides the nasal cavity into left or right. So this nasal septal is a wall of bone and cartilage. Okay, and turbinates. These turbinates increase the surface area inside the nose, which filters, warms, and humidify the air. And these are of three parts, that is superior, middle, and the inferior. And nostril is just an external opening of the nose. So this is nose, no nasal cavity and nose. Okay. Now coming to next part, that is the paranasal sinuses. So the paranasal sinus is nothing just an air-filled spaces surrounding the nasal cavity. This one is nasal cavity, and the surrounding space, the surroundings air-filled spaces contains the paranasal sinuses, and these sinuses are in four major group, and these are in pair. So these paranasal sinuses are eight in number. So these are in pair. So there are four paranasal sinuses: the frontal, ethmoid, maxillary, and the sphenoid. Okay. So this frontal sinuses is present in the forehead region, that is just above the eye. You can see here in the green. Okay, this is frontal. Front means forehead. Forehead side, in the forehead region, the frontal sinus is present. Okay, now the second one, that is ethmoid. Ethmoid sinus is just present in the between the eyes on each side of the nasal cavity. This one is nasal cavity, this one is nasal cavity, and between the two eyes the ethmoid sinuses is present, purple color. Now the third one, that is the maxillary sinuses. This maxillary sinus is present in the cheek region. Okay, and the sphenoid sinuses is present deep behind the nose and in the sphenoid bone. Okay, in the sphenoid bone deep behind the nose, this is present. Okay, so this is an frontal view, this is sagittal view. So these were the paranasal sinuses. Just learn the where these sinuses were present. Okay, so this will help in the coding. Now coming to next, pharynx. So the pharynx is what? Pharynx is a muscular passes behind the nose and mouth. It is divided into three parts: nasopharynx, oropharynx, and laryngopharynx. Okay, so these nasopharynx, which is shown in the green. Okay, so this is located behind the nasal cavity. The oropharynx, which is present behind the oral cavity, purple in color, you can see here, and the laryngopharynx located behind the larynx. Okay, coming to next, so these were the pharynx part. Okay, coming to next, that is larynx. So the larynx is commonly called an voice box, and it connects the pharynx to the trachea. Okay, and its major role is protect the lower airways and produces the voice. So in the larynx there is three part, that is an epiglottis, glottis, and epiglottis and glottis, and the vocal fold. So epiglottis, what it will do, this one is epiglottis. So epiglottis is just help to prevent food from entering the airways during the swallowing. When we swallow food, it helps to prevent the food entering into the airway. And the vocal fold, that is an help in the voice production. And the third one, that is the reason in glottis, it is reason involving the vocal folds opening between them. And in the glottis, just above the glottis there is an supraglottis, and just below the glottis there is subglottis. Okay, after that so these were the structures of larynx. So coming to next, trachea. So trachea is what, it's an airway connecting the larynx to the bronchi. And the trachea, this one is trachea, and this one is tracheal cartilage, annular ring. Okay, so there is a point where carcina of the there, this one is trachea, and there is a point carcina from where the bronchus has been, trachea is divided into two main bronchus, that is right and the left bronchus. Okay, so this one is trachea. Okay, now coming to next, that is the bronchial tree hierarchy. Bronchial tree hierarchy is very much important to understand. Okay, so the system starts at the top with the trachea, which is also known as the windpipe, which acts as a main trunk. And this trachea splits into, divided into left and right main bronchi. Okay, and in the right bronchi, there is an lobes, three lobes present, upper, middle, and lower in the right side. And in the left bronchus, which is divided into two parts, that is left upper lobe and the left lower lobe present. Okay. So coming to three, this one, as we moves down, you can see by the help of color, as we move down, this one is two main bronchi. As we move down, then the airways branches into the lobar, that green one, and the segmental, that is five number, and after that the subsegmental bronchi, which is yellow in color. Okay, and they become progressively smaller to distribute air deeply into the every section of the lungs. Okay, and in the point 7 number 6 and 7, that is bronchioles and terminal. So next tube transition into the bronchioles and the terminal bronchioles. So these are the tiny narrow pathway that that lacks the cartilage but smoothly guide air towards the end of the line. And as we moved, so the point, the gap, finally reaches the zone, and consisting of the respiratory bronchioles and alveolar ducts and the alveoli. So these were the microscopic structures, you can see, looks like a cluster of grapes. Hmm? And the alveoli is the very much important part here, because this is the point where the oxygen enters into your blood and the carbon dioxide removed. Okay, so in short we can say that the system branches from the one large tube, that is a trachea, and then it into the then it get into millions of the microscopic sacs, or to maximize our ability to breathe. So this is a bronchial tree. Okay, one large tube trachea divided into two parts, that is main bronchi, right and left. After this is divided into these two, divided in these main branches divided into the three lobes in the right, and in the left there is divided into two lobes, that is right, upper and lower. After that, these were the segmented into the lobar, segmental, and subsegmental bronchi. After that, it gets bronchioles, terminal bronchioles, then alveolar duct, and the alveoli, which is grape like structure from where the oxygen enters to the blood and carbon dioxide removes. Okay, so coming to next, that is lungs and the lungs fissure. So as we know that the lungs, as we discussed previously, that the lungs are two, right and left. In the right lungs there is three lobe: right upper, right middle lobe, and the right lower lobe. So in the and the left there is two lobes, that is left upper lobe and the left lower lobe. So in the right lungs there is two fissure, that is right horizontal fissure and the right oblique fissure. But in the left lung there is only one fissure because there is only two lobes. So there is one fissure, that is left oblique fissure. Okay. So just in structure, just learn where the structures and which names are there present in the lungs. Okay, so it will be easy for all that help in the coding. Okay, coming to next, that is lingula. So lingula is the present in the left lungs. Okay, in the left upper lobe. It is not in just a separate lobe, and this left upper lobe is divided into two parts. That is an upper division, and the lingular portion. And the lingula is described into segments. That upper division having the superior lingula, which is superior segment, and there is an inferior segment in the lingular portion. Okay, so this one is lingula. Coming to bronchopulmonary segments. So the bronchopulmonary segment, we can say that the lungs having the two lungs, right lungs and the left lungs. Okay. So in the right lung, there is how many lobes? There is three lobes: upper lobe, middle lobe, and the lower lobe. And in the left lung, how many lobes? Upper lobe and the lower lobe. And in every lobe, there is specific segment is present. Okay, so in the upper lobe there is three segment present: apical, posterior, anterior, anterior. Middle lobe two segment, lower lobe five segment. Okay, left lung upper lobe having the two segment, that is S1 and S2, that is segment 1 and segment 2, that is which constitute the apico posterior, and the segment third, that is anterior. And the lingula having the two segment, that is an because it is this lingula is present in the left lung, so superior lingula, inferior lingula. And in the lower lobe there is a four segment, that is superior, anterior medial basal, lateral basal, and posterior basal. Okay, so why this bronchopulmonary segment is important in coding? Because, for example, the surgeons documented like the right upper lobe posterior segmentectomy. Then we can't understand like that the surgeons removes the whole upper lobe. No, we will break like this. First, ask the question to yourself that which lungs is present. So here it is right lungs. In the right lungs, which lobe is present? Upper lobe. And in the upper lobe, which segment is present? That is posterior segment. Okay. So by this way you can understand. Now the second example, lobectomy. It means entire lobe has been removed. Now, the third segmentectomy, it means the specific anatomical segment has been removed. And the wedge resection, that is small wedge shaped portion, has been removed. So this is the basic anatomy of the respiratory system. So in the next video, we'll see the procedures. Okay, we'll see the procedures of the respiratory system: septoplasty, rhinoplasty. So in the next video we'll meet. Okay guys, thank you.